Good morning, all of you. Let us start the class. Actually, last class we started with the spatial distribution of healthcare. In continuation with, we are going to continue the same topic. Before that, what we discussed in the last class, I'll just make one revision and then we'll go to the next PPT. See, as far as the distribution of healthcare facility is concerned, the India is following three-tier system. This particular three-tier system was introduced by Health Survey and Development Committee in 1946, famously known as Bohr Committee report. In that particular three-tier system, there will be three different levels. The first level is sub-centers. That sub-centers should have minimum of 5,000 population, and it will be 3,000 for hilly or tribal area. This is the first level. Based on that particular sub-centers, there will be a primary health center. 5 to 6 sub-centers will be monitored by the primary health center. So this particular primary health center is a second tier. The third tier is community health center. That community health center is a minimum of 1,20,000 rupees. People should be there in that plain area, and it will be around 80,000 in a hilly, tribal or typical areas. So this is called three-tier system. What I given data is the Government of India data published in 2015 by the Health Department. Before moving to the individual level, first we should be familiar with what are the public care facilities that are given with the public and private. In public side, there will be 9 spatial distribution, and in private it is 5. They are: number 1 is community health center. We used to call it as CHC. The second one is primary health center, that is called PHC. Third one is so-called SC, that is health sub-centers. Apart from these three, mother and child welfare scheme, MCWC. Then fifth one is tuberculosis clinic, TBC. Then hospital allopathic medicine. And seventh one is hospital and other medicines. Then eighth one is dispensary. And finally, the family welfare center. These are the 9 different centers for spatial distribution of the healthcare facilities. This is from the public side, that is the government owned. Coming to the other side, that is private one. Apart from that particular thing, private or non-government health facilities, there are 5 categories they have given. One is non-government facility with outpatient service only. Only outpatient will be there. Then the second category is non-government facility with both in and outpatient service. Then the third one is charitable non-government facility. Then fourth one is all medical shops. And finally, the other facilities like a clinic and other private scan center, all these things are also coming under the private healthcare facility distribution. So this is what we discussed in the last class. In continuation with that, I am going to continue the same distribution of healthcare in the next PPT. Now I am sharing that. Just stay online. Today we are going continuing the second phase of the thing. Under this particular topic, there will be a number of section A questions. Question I have extracted from the previous. Yes. Have any doubt? Okay. These are the section A question I have extracted from the previous question paper. 2 years, totally 4 question paper I have extracted, and then I prepared answer for that. Basically they asked one particular question: what we mean by health distribution. So first you should know what we are trying to mean about health distribution. Population health has been defined. First you should say what is public health. You, in technical term, in economics we used to call population health, nothing but public health. The health outcomes of a group of individuals, including the distribution of such outcome within the group. That's what the WHO has defined about the public health. Measuring the population health and the distribution can unite the group across the sector around a set of clear and well-defined goal for the distribution of healthcare sector. So first you should say that is the group. that group should have connected with the next group and aggregatively with a political territory, we used to call it as public health. Public health means that particular country what is there. In India, there is a three-tier system. What three-tier system? Community health centers, primary health center, and sub-centers. Based on that, we distribute the health. Second possible section A question. What do you mean by health care facility? First one is distribution of health. Second one is health. What are the facilities that we are able to? The health care facility are the place where we can provide the health care. They include a number of centers like hospital, clinics, outpatient care centers, specialized care centers, or some Anganwadi. All these things are also represents the healthcare facility only. That is one valiant. Well, suppose சில பேருக்கு வந்து ஈக்குவலி நோயா இருக்கும், another 1 month or 2 months தான் இருப்பாங்கன்னா அவங்களுக்கு வேலியன்ட் கேர் சென்டர் இருக்கு. அவங்களுக்கு வேண்டியது ஏன்னா வச்சு காப்பாற்ற முடியாது, அதுக்குன்னு ஒரு ஹாஸ்பிட்டல் இருக்கு. அந்த ஹாஸ்பிட்டல்ல தான் அதுக்கு டெக்னிக்கல் டேர்ம் என்ன சொல்றாங்கன்னா சொல்லுவாங்க, ஹாஸ்பைஸ் அப்படின்னு சொன்னா குறைந்த நாட்களே உயிரோட இருக்கிறவங்க, ஆனா அவங்க லைஃப் லீட் பண்ணி தான் ஆகணும், மெர்சிக்கல் தான் பண்ண முடியாது. அதனால என்ன பண்ணாங்க, கவர்மெண்ட்டும் பிரைவேட்டும் சேர்ந்து ஹாஸ்பைஸ் அப்படின்னு ஒரு ஹெல்த் சென்டர் ஆரம்பிச்சு அதுக்கு அவங்களுக்கு வேண்டிய அவங்கள சந்தோஷமா வச்சிருப்பாங்க. தட் டூ சில பிரைவேட் சில இது சேரிட்டபிள் பேசிஸ்ல ஃப்ரீ ஆஃப் காஸ்ட்ல அது செய்யறாங்க, கவர்மெண்ட் அதுக்கு கிராண்ட் கொடுக்குது. தென் அதர் பாசிபிள் செக்ஷன் A question, what are the two types of healthcare services? Last time they have asked. It's a very there should be two types of healthcare center in India. One is called public healthcare center, another one is private healthcare. You just say public healthcare means they are run by the government, it is a non-profitable purpose. What is there? Then on contrary, it is private means they run by the private people or companies and it is offered by only those who have. Why? Because there are some medical treatment requires visions and other technology. Sometimes the government cannot afford. Only the there are two types of healthcare service. One is rendered by the public healthcare. The second one is by private healthcare. Similarly, another possible question: what are the different types of healthcare facility? There you can line a number of things based on section A or section B. You decide. Suppose section A means minimum 3 you have to write and make one sentence each. Suppose it is in section B, you have to write 7 or 8 and you explain. Definitely this question will be possible either in section A or section B. So what are the different types? First you should say about the hospital. It is primarily provide a diagnostic and giving treatment to the patient who are having an intensive or immediate care. There are different wards, emergency ward, special ward, ICU, all these kind of different healthcare center will be there in that hospital. So hospital is considered to be the first type of healthcare facility provided by both public and private. Then another one is outpatient clinic. That will be a visiting doctor and those who are ill or sick can go there and they can contact the service provider and they can receive that particular healthcare service. The third one is long-term care facility. Some people have to be admitted and they have to they are considered as an inpatient. So for that there are some facilities not only public but also private. Other things are clinical lab, hospice, dispensary. All these things are considered to be different types of healthcare facility. You can expect a question. Similarly, the next one is mention the private healthcare facility in India. As far as India is concerned, in medical field, compared to public healthcare, the private is dominant. Why? Because for every 2.5 lakh people, the government can able to afford only 6 beds. But if you take a private, for the same people, they can able to provide more than 34 beds. So more than 5 to 6 times the health facility is available from the private only, not in public. Because we are following a 3-tier system. The subcenter for every 1,20,000 rupees, that is one community center. But whether that much community center we can able to afford, the government find difficult. That is why they encourage the private to render the service. So as far as Indian scenario is concerned, the private healthcare facility is predominant. So,
Ramenda.
whatever, yes,
Ramenda.
any doubt? Let me continue.
Ah.
Some of the healthcare
Rama.
facilities are urgent clinic, nursing home, orthopedic center, mental health center, hospice homes. Like that, there are different healthcare facility rendered by the private people. You have to mention that. I think some people kindly mute all of you, please. Now, the other possible section A are what we mean by healthcare inequity. That will be inequality in rendering the healthcare service. Why? Because economically sound people can avail the health facilities compared to the poor. Why? Because they cannot able to afford it. So that is why there is a inequality in the healthcare services. It is not only applicable for India but also the rest of the country, because globally it is as far as the health service is concerned, everyone should be treated equally. But unfortunately, we are not able to give equal kind of service to the யாரோ சத்தம் கேட்டுட்டே இருக்கு. எஸ்,
இந்த பரணி பையன் வேற போன் பண்ணுகிறான்.
யாரோ அன்மியூட் வேற யாரோ பேசுறாங்க.
என்னன்னு தெரியல.
So healthcare inequality is one of the hurdle for spatial distribution of healthcare facility. The World Healthcare have initiated a number of steps to eradicate this, but somehow the developed countries alone is helping that. But as far as developing country like India, we are not able to give full support. Why? Because our system of healthcare facility is not encouraging that. Why? Because we are following three-tier system. The two predominance is in the hands of the private people. Then what are the 5 facilities to hire the healthcare employees? So suppose you are in a medical field, what are the job opportunities that you can have? Means you can get a job in a hospital, you can get a job in a doctor office. There will be number of diagnostic center there. Graduation in economics is eligible for that, and elderly and mental health
உள்ள தூங்குறியா?
யாரும் அன்மியூட் பண்ணாம பேசிட்டு இருக்கீங்க, டிஸ்டர்ப் ஆகுது. நான் அன்மியூட் பண்ணமா எல்லாரையும்? Finally, the home care. Some people may need paramedical help. For those people, there will be a staff nurse and you can get. So there are n number of job opportunity for the healthcare employees. Then we should know what are the level that we can afford in that particular hospital. There are different level of healthcare facility. Like basic level is just to get some antibiotic and other things, just diagnosing. Second one, acute care. Then long-term acute care, intensive care unit, and LTAC. The people used to say long-term care hospitals. And apart from that, there are some sub-acute care and transitional care centers, inpatient inhabitation. That is, some people may have bad habits. They find difficult to come out of it. For that, there are some centers which help them to come out from that. Apart from that, there will be SNF. I think SNF, skilled nursing facility, because there are certain diseases they require complete skill for the staff nurse. Especially if you take our corona, all cannot cure. For that, you have to equip yourself, and what type of antibiotic and what type of medicine that should be given. We have to have a regular checkup with that. For that, we need a skilled nurse. So that is why this skilled nursing facility is predominant as far as all cities of India is concerned. Apart from that, there are some intermediate care center, that is giving first aid, and before hospitalizing, what are the medical treatment, what to be done, and what is the procedure for that. Apart from that, home health care centers, especially hospice care is now very famous in India. So these are all the some of the spatial distribution of healthcare in India. Finally, I'm concluding with this. What is the difference between healthcare product and health service product? We should know. There is a difference between healthcare product and health service product. The major difference you should know that both are look alike, but the first one is physical in nature. It is tangible. You can see, touch, or the second one is a service product. It is not physical. Physical presence may not be there. Highly intangible, but you can feel. You can receive. Why? Because it is a service. For example, nurse, all paramedical and other things, most of the services are health service product. But like a stethoscope and BP machine and other scan machine, all these things, this is called healthcare product. But service of the doctor or nurse or compounder or any paramedical specialist advice, all these things are health service product. See, where the health service product is more, there will be a prevention of illness. So we badly need equal importance for the health service product also, because prevention is better than cure. But we need the physical product also, because without having all medical instrument, it is difficult to render the service. So understand the basic difference between the health product and health service product. What is the major difference? These two are look alike, but if there is a physical nature and tangibility is there, then it is called health product. Suppose it is not physically present and you can see, it is intangible, means service product. Apart from that, what are all the advantage who are working in the healthcare? Suppose this BA, there is enough scope to get a job. Why? Because there is a constant demand for the health service. One of the studies says, United Bureau of Labor Statistics said the healthcare industry is projected to go 18% from 2020 until 2026. Why? Because unmute பண்ணுங்கப்பா, நான் unmute பண்ணா நல்லா இருக்காது. Check. Where we can get, first of all, you will have a good pay and more number of benefits. Number of working days, it is adjustable. Why? Because when you study, suppose you are doing a PG and you are doing any other course, means it is adjustable. Why? Because paramedical people or medical people badly demand in the evening only, evening or night time only. You can work in the night. Why? Because at that time we need, because 24 hours the medical field should work. So there will be a good employment opportunity in the medical field. Not only that, there will be a constant demand for that, because almost 130 crores people are there, and nearly 20% of people are sick, and they are badly need the medical service. So there will be a constant demand in the health field. That too, he who complete their degree can get a good job and continuous job. There won't be any seasonal job. It is a continuous job, and remuneration will be more compared to the other field. Apart from that, the most important is we can get a chance to help the people. Service to human is service to God. So that is why the medical field is considered to be a noble profession. So keep in mind, not necessarily that you should get a clerical work. After completing BA Economics, you will be employable in the medical field, either as a front officer or you may be a medical officer, and you can maintain good rapport with the medical field. There is a n number of job opportunity in the medical field. With this, I am winding the class. If you have any doubt, you can ask me now. From 21st onwards, we are having the second CA. The portion will be what we covered so far. First 2 units will be the portion. Of course, sorry, not only first 2 units, but also some topic led by Professor Telu Suvarna. that also will be the portion. Better I avoid the first unit, unit 2, and what you discussed with Professor Telu Suvarna. That will be the portion for the second CA. Prepare well. We will meet tomorrow.